In this lecture, we're gonna speak about the phobia. Phobia is one of the most common disorders. A phobia is a type of anxiety disorder. It is a big irrational fear that poses a little or no real danger. There are many types of phobias. We could have acrophobia, is a fear of height. We could have claustrophobia, which is a fear of closed-in places. We could have agoraphobia, is a fear of public places. We could meet people with driving phobia, with water phobia, with spiders phobia, with animals phobia, with blood phobia. We have many types of these phobias. People are trying to avoid what they are afraid of, but if they can't, they could experience kind of trembling, high blood pressure rate, high heart rate, and a desire to go away from this danger. Phobia starts from children and continue into adulthood. Treatment helps most people with phobia. Treatment options include medicine and therapy or both. Richard Bandler and other NLP developers have developed different types of techniques for different types of phobias. They based on the work by Alfred Korzybski, Science and Sanity, 1933, and Leslie Cameron Bandler, Emotions in Hostage, 1987. These works stated that all emotions require time to express their meaning. So switch in the temporal perspective reframes the emotions. The emotion is reframed, so it disappears. For the people with spider phobia, they made a big image of a huge spider on their head. And when they think about spider, they experience the fear because of this big image. Richard Bandler said that this image, we can ask the client to shrink down and blink between black and white many times as it disappears. After getting rid of this fear, people realized that they were wrong about their limitation and ability. So we come to the idea delivered by the metaphysicist people. The only real emotion is love. But the negative emotion, fears and phobias and bad emotions are illusion. Our procedure to delete the phobia is based on 6 steps. We have to do it in an accurate way to have excellent results. First one, make the client remember the first event. When has the first memory with the problem. Let him remember the feeling, emotions. Have the client to go back to the first event, the earliest memory he can consciously remember. Second step, make a movie screen above the timeline, and have the client watch from the projection booth. 3. Run the movie forward in black and white to the end. Freeze frame at the end and black or white out. Have the client associate in the memory and run the memory backward in color to the beginning. Repeat steps from 2 to 5 until the client cannot get the feeling. Now, last step, we can make a test. The best test is to tell the client to imagine that he goes 15 minutes into the future and test the feeling. If the feeling doesn't appear, come back to the now.